Welcome, friends. I am Dr. V.K. Chauhan, homeopathic physician. Revise with me homeopathic remedy Borax Veneta. This is part 7 clinical correlation, and the text is taken up from Ellen's keynote, and this is good for BHMS students and interns. So we go to the first PQRA, dread of downward motion in nearly all complaints, and PQR first B, great anxiety from downward motion when laying the child down on a couch or in the crib, cries and clings to the nurse when rocking, dancing, swinging, going downstairs or rapidly downhill, horseback riding, and here we have comparison with Sanicula. So let us recall dread of downward motion or the fear of falling is also referred to as basophobia or basiphobia, not being able to stand and walk. The origin of the word bas is Greek meaning stepping and phobia is Greek for fear. The cause combination of external traumatic events and genetic predisposition is the cause for this. Clinical the for fear of falling in infants, the infants fear falling as they are born with immature central nervous system. They cannot interpret or handle the certain sensory inputs like the feeling of falling, and fear of falling is also seen in elderly, and it is due to the prevalence of fear of falling increases with age and is more in females. That has been noticed. The PQR1C is children awake suddenly, screaming and grasping side of cradle without apparent cause. Similar remedies include apis, cinna, and stramonium. Let us recall these features point to sleep starts. Just after falling asleep, the child wakes up with a sudden fearful crying. While falling asleep, the sensory relay station thalamus becomes inhibited. The thalamus is the pathway through which sensation becomes conscious. If the brain doesn't receive information on the direction gravity is acting, the individual may wake up with sudden jerking movement. It may be more commonly seen to cause the entire body to jolt suddenly. In some cases, a vocalization or sharp cry may occur. PQR2 is excessively nervous, easily frightened by the slightest noise or an unusual sharp sound, coughing, sneezing, crying, lighting a match, etc. Similar remedy are asarum and caladium. So recap, these features point to phonophobia or ligyrophobia, an anxiety disorder. In this condition, sudden sound and unexpected sound brings anxiety attacks. Clinically, we see the individuals anticipate and always fear the moment when an unexpected sound can occur. Unexpected sounds bring anxiety attacks, excessive sweating, desire to flee, panic, fainting, and irregular heartbeat. So, noise anxiety treatment includes adopting a coping mechanism such as the use of earplug as well as cognitive behavior therapy. PQR3, hair becomes frowsy and tangled, splits, stick together at the tips. If these bunches are cut off, they form again, cannot be combined. We have similar drugs like fluoric acid, lycopodium, soranum, and tuberculinum. Let us recall hair tangling. Curly hairs are especially prone to frizz. These Persky tangles are caused when the outer layer of hair becomes damaged and open up. Clinically, healthy cuticle is smooth and closed. More the damaged, worse the tangles. It is caused by heated styling tools, blow dryers, curling irons or flat irons, and their repeated use rob the hair of moisture and cause frizz. PQR4 is eyelashes loaded with dry, gummy exudation, agglutinated in morning, turn inwards and inflame the eye, especially at outer canthus, tendency to wild hairs. Let us recall the above features point to blepharitis. It is an inflammatory condition affecting around the base of the eyelashes. Trichiasis is a condition which is characterized by eyelashes turning inside, causing pain, redness, and tearing. Clinically, the signs symptoms include itchy eyelids, red, irritated, and watery eyes, flaking and crusting at the base of the eyelashes, photophobia, glittery feeling in the eye. Symptoms are worse in the morning. We have PQR5A, nostrils crusty, inflamed, tip of nose shining red, red noses of young woman. We are dealing with red noses of young woman at this point. Recap. Red nose of young woman points to rosacea of the nose. Rosacea is a common chronic skin condition. Clinically, you will find that it affects the central third of the face, especially the nose, and its intensity varies over time. Sign symptoms includes it redness of the face, telangiectasis on the facial skin, and rhinophyma, an enlarged bulbous red nose. We find PQR5A, nostril crusty, inflamed, and PQR5B, stoppage of right nostril of first right then left. Let us recall scabs and blocked nose. Common causes are allergy, nose feels itchy, provokes scratching, leading to inflammation, bleeding, and scab formation. This is a chronic nose condition. And then we have irritation. Following the irritation, the nose causes inflammation and scabbing, fumes, industrial chemicals, cigarette smoke. These are the possible causes. Forceful blowing causes further harm to the nose and pushes infection into the sinuses. PQR6A, apathy in the mouth, on the tongue, inside the cheek, easily bleeding when eating or touched, prevents child from nursing with hot mouth, dryness and thirst, cracked and bleeding tongue, salivation, especially during dentition. So in F3, what we find, aphthous ulcer on the labial mucosa, what we see here. Note the erythematous halo surrounding the ulcer. Clinically, the aphthous stomatitis is characterized by repeated formation of benign and non-contagious mouth ulcers in otherwise healthy individuals. The cause is not known. However, it appears to involve a T cell mediated immune response triggered by a variety of factors or causes. The triggering causes include emotional stress, mechanical trauma, nutritional deficiency, particularly of vitamin D, iron, and folic acid. Certain food, including chocolate and toothpaste, can be offending agents. Iatrogenic causes is nicoradril given for angina. Viral infections. These ulcers occur periodically and heal completely between attacks. In the majority of the cases, the individual ulcer lasts about 7 to 10 days and the ulceration episode occurs 3 to 6 times per year. We have PQR6B, aphthous sore mouth of old people, often from plate of teeth. So let us recall, oral mucosal lesions usually occur wearing ill-fitting dentures in the elderly. Clinically, oral health status is important for the quality of life owing to the physical, social, and psychological factors. Early detection and prevention of oral lesion by dental practitioners can improve the quality of life of this population and aid in the attainment of quality aging. We have PQR7, child has frequent urination and screams before urine passes. We have similar remedies like Lyco, Sanicula, Sarsaparilla. Let us recall, these features point to lower urinary tract infection called cystitis. This is more common in female child. Young children with upper respiratory tract infection present with fever, vomiting, irritability, feeling of tiredness, and loss of appetite. Clinically, older children with UTI may present with sudden need to urinate often. Loss of control of urination means incontinence and pain while urinating, difficulty in urinating, pain above the pubic bone, and blood in urine, bad smelling urine. PQR8, Licoria, profuse, albuminous, starchy, with sensation as if warm water were flowing down for 2 weeks between the catamania. Compare Bovista and Conium. So we have white discharge or leukorrhea. Features suggest physiological leukorrhea, more of a normal vaginal discharge. It can be due to estrogen excess during puberty, menstrual cycle, and pregnancy, and during sexual excitement. Clinically, the common features include usually described as copious whitish mucus discharge with no odor or irritation. The discharge can vary in amount throughout the month and it can be very annoying. Diagnosis is made by a wet mount with epithelial cell without evidence of inflammation or absence of infection. Treatment for profuse discharge is to change underwear frequently during the day. PQR9 tells us about skin unhealthy, slight injuries suppurate, We have calendula, hypersulf, mercuris, and silesia, similar remedies. Clinically, we find unhealthy skin can be due to systemic factors like age, malnutrition, eating unhealthy food, vitamin deficiency, congestive cardiac failure, and obesity are associated with diabetes. Chronic skin conditions such as eczema, lack of sleep and regular exercise, sleep deprivation weakens the body's immune system as stress exercises causes the body to release endorphins that reduces the stress level. Iatrogenic causes are steroid and other immunosuppressants. So friends, thank you very much for patient listening